Hi everyone, my name is Kevin Munn. I'm a second year medical student at the Spokane Foundation site, and today I'll be talking about my poster, which is titled Feasibility of Completing a Comprehensive Geriatric Assessment in a Multidisciplinary Bladder Cancer Clinic. So, a little bit of background. Bladder cancer is one of the most common cancers in the US, with the cancer occurring in mostly older patients with multiple risk factors like smoking and obesity. The gold standard treatment for bladder cancer is a radical cystectomy. Unfortunately, this procedure has a risk of major postoperative complications in up to half of all patients with this cancer, with a high risk of admission and a high 90-day mortality rate. This is why it's imperative to accurately assess the patient's risk profiles at diagnosis to choose the best treatment option. So the University of Washington Bladder Cancer Multispecialty Clinic has been using comprehensive geriatric assessments, or CGAs, to stratify patients with bladder cancer based on their physical function, physical ability, physical frailty, mental health and cognition, and nutritional status. Um, a knowledge gap still exists regarding the feasibility of implementing these assessments, the CGAs, in a clinic, and how they ultimately affect the clinical outcomes of patients with bladder cancer. So the methods that were used for this particular project was we conducted an analysis of a previously completed prospective observational cohort study, which involved 94 patients seen at the UW um, Bladder Cancer Multi-Specialty Clinic, or over telehealth, from June of 2020 to July of 2021. Patients were divided into two groups by assessment type. Um, Group A was the standard assessment, while Group B involved the comprehensive geriatric assessments, or CGA, which was performed by the patient and the study team. The primary outcomes were: one, feasibility characteristics of the CGAs, and two, patient-reported burden. So the results showed that the median age of all patients that were involved in the study was 71 years old, with 82% of the patients being male and 18% being female. The median age at bladder cancer diagnosis for these patients was about 69 years old. The majority of the patients in the study was white, and 17 patients were evaluated in a telehealth setting. The completion rate of the CGAs was high, ranging from 79% to 100%, and the median time to complete the CGA in person was 18 minutes. And about half of all patients believed that completing the CGA was not burdensome. Discussion shows that the one limitation is the modest sample size, but these results importantly show that CGAs can be implemented in more participants across urology clinics at the UW. And future work is needed to assess associations between core domains and clinically relevant outcomes.